Welcome to Barcliff Group Fireside Chat. We're very glad you joined us. Our topic today is, where do I go? Emergency room or the urgent care? Urgent care centers and walk-in clinics are popping up like dandelions all across the country. How do you decide where you can get the best care for your health issue? The services available at each location plus their cost may help you make that decision. We're fortunate to have Ken Stackhouse with us to answer those questions. He holds a master's in business administration and a master's of science in nursing. He is a dual trained certified family emergency nurse practitioner. He has 40 years of clinical and administrative experience in healthcare. He is an advanced nurse practitioner and has worked extensively in both emergency rooms and urgent care clinics. He teaches emergency and trauma care to nurse practitioners at the University of Texas Health Science Center in Houston and to the Family Nurse Practitioner Program at Texas A&M University in Corpus Christi. He began his career as a firefighter. He worked as an EMT and a paramedic, and he has had quite a journey through the emergency and trauma healthcare system. Ken, thank you for being here to provide some clarity about when to choose an urgent care over an emergency room or calling 911.
Hey, thanks, Dana. And like a lot of people, I'm not only a person that works in emergency, but I'm also a patient. And I have been a patient in an emergency setting before after a motorcycle crash and broke both my legs. So I understand it from both sides. And thanks for being here.
Well, I do as well. I one time made the mistake at 3 a.m. of going to an urgent care center when I really should have gone to the ER, and they redirected me very quickly. So I do understand that. Is there a difference in the quality of care that we would get in an emergency room versus an urgent care center?
Yeah, so, the quality of care won't be much different at either one of them. What happens is it's the level of care that you can expect at either one. Like you said, going to an urgent care with a condition that may not require or may require more than an urgent care can provide is going to be identified at that urgent care setting. If you go in with a sore throat, for instance, and it's you have strep throat, you're going to get the same quality of care at the emergency department that you would at the urgent care. You'll get your evaluation and treatment done no different at either setting. So the quality of care won't be any different. Sometimes in the emergency department, you're going to have people that are trained in the emergency department in the urgency. Excuse me. You're going to have people that are trained in the emergency setting. They're trained to identify and treat emergency conditions. In the urgent care setting, you may or may not have that level of training, but you're still going to get the same quality of care for the presentation that's at that setting. Does that make sense?
Yes, it does make sense. And it makes me think about timing. Will you get quicker treatment or be seen faster at an urgent care as opposed to an ER? I've seen horror stories of emergency rooms with people filling every chairs and spilling out into the hallways.
Yeah, not only have you seen those, I've actually lived those both as a patient as well as a provider in the emergency department. I've seen what that does to people sitting in the waiting room for 12 hours, 8, 10, 12 hours is miserable. So in the grand sense of things, you might get treated quicker in an urgent care setting. They're designed to take care of those quick in and out type of presentations. You've got your sore throat, your urinary tract infection, you've sprained your ankle, you've got a minor laceration, things that are quick and easy to take care of that shouldn't take long, won't backlog people waiting into their waiting rooms at the urgent care. Most emergency departments have systems in place to take care of those minor type presentations, if you will, and minor conditions, such that they can take them in and out a little bit quicker. But overall, we've all heard about emergency department overcrowding, and the efficiencies that can be managed in the emergency department are great, but sometimes they get overwhelmed. So to answer your question about can you get seen quicker at an urgent care versus an emergency department, is kind of a tricky question. If you come into the emergency department with chest pain or a stroke, or you've cut your arm off, then you might get seen a little quicker than you would at the urgent care. The urgent care is going to see you quick, but then they're going to do just like they did you or Dana at 3 o'clock in the morning. They're going to redirect you to the emergency department, which will be the appropriate care setting for you. So the answer to that question is kind of tough, but I think it's more about convenience at that time. At 3 in the morning, where can you find the care for your condition? Some urgent cares aren't open at 3 in the morning, so therefore the emergency department might be the quickest setting for you at that time.
I guess that's true. I know I would think that urgent cares would be open 24 hours a day like an emergency room, but it is possible that they're not. So it would be important for someone to check to see if that urgent care is open before they make the drive there.
Right. And if you think about it, at 2 o'clock in the morning or 3 o'clock in the morning, your 2-year-old child screaming because their ear hurts may not technically be an emergency condition, but it's certainly an emergency to you at that point in time and to your child who's hurting. And we don't want people to be hurting. And therefore, if you've got an urgent care that's open 24 hours, it's a perfect place for you to take your child and to be seen. If not, then definitely the emergency department's a great alternative for you, because it's going to be several hours before your doctor's office opens up or that urgent care opens up, and you don't want your child screaming for the next 4 to 6 or 8 hours waiting for that to occur. So
that's true. That would be heartbreaking.
Yeah.
The other thing I was thinking of is from all of the TV shows that I've seen of emergency rooms, people are triaged. And so they would probably be triaged based on their injury in an emergency room. And that's how you get seen faster. The more serious your condition is, like you said, your arm has been cut off, the quicker you're going to be seen, as opposed to the child that's screaming with the ear infection or the earache.
Yeah, unfortunately, if there's an overcrowding of the emergency department, you've got lower resource allocation to have, because people are crowded waiting to be taken upstairs to the hospital, those type of things, or there's just way too many people showing up to the emergency department for the resources available at that time. You're going to get triaged accordingly, and that means that your arm falling off, life and limb comes first, and certainly screaming and crying child with ear pain is an urgent and can be an emergent condition. But once you're seen and identified that it's not truly an emergency according to life and limb, then you may have to wait a little bit longer.
So what does an emergency room have available that would not be available at an urgent care?
That's a great question, Dana. I think if you think about, number one, most emergency departments that you're familiar with have a hospital right there with them. So if you need surgery immediately or urgently, you've got that capability right behind you or in the same facility. You've got people that are, like I said before, you've got people that are trained to identify emergent conditions and then rapidly treat those emergent conditions. You've got diagnostic capability in the sense of testing. You've got laboratory, you've got radiology, you've got CAT scan, ultrasound, as well as more people, a resource of people. In an urgent care center, you may have lab and you may have x-ray. Some urgent cares, few and far between, have CAT scan and ultrasound. So if you think that you might need a CAT scan or ultrasound or even an x-ray, you may want to call ahead to ask if they have if the urgent care has those resources available in their setting, and even in their setting today, because there's a shortage of radiology techs, that people that actually do the x-rays. They may not have somebody on duty today, whereas the hospital is going to have that resource available. Additionally, medications. The emergency department has the medications available to take care of the emergent situation. Urgent cares are designed to take care of the sore throats, the urinary tract infection, maybe minor abdominal pain, sprained ankle, those type of things, and don't have near the medication and pharmaceuticals available to them as well.
Well, this also then brings up another question. With some of those things that are simple, like labs or the treatment that you were talking about for simple things or not as serious things like urinary
Yeah,
tract infections, earaches, sore throats. Could you use a walk-in clinic as a PCP, a primary care physician?
absolutely. And over the years, with it's becoming harder and harder to get into your primary care. It may take you 6 weeks to get an appointment with your primary care in some settings. A lot of people use the emergency department as their primary care setting because they can't get in to get their refill or whatnot. So definitely you can use an urgent care or even a convenient care center as a primary care. Now, not all urgent cares are set up to have that continuity of care that we've seen you 2 or 3 times in the last 6 months to take care of your primary care condition. But some of the urgent cares are available for that and actually market that as part of their services provided. So definitely know what urgent cares are in your area, and maybe even give them a call and ask them, hey, can I come in and have you as my primary care provider? Some of them will do that, definitely.
And I thought that was an interesting question because recently my sister was looking for a primary care physician, and on her list in her insurance network, it showed several urgent care centers. And I thought, well, that's really interesting because I had not heard of urgent care actually serving as a primary care physician. But if they're offering those services now, that would be great, especially in areas that are underserved or don't have a whole lot of doctors in the area. A primary care physician at your urgent care would definitely be beneficial and convenient.
Most definitely. And if you think about it as well, when we talk about the difference between emergency department and urgent care, in the emergency department, every emergency department is going to have at least one physician on duty at any given time. And I take that back. I have actually worked in a critical access hospital where I was that one provider. And so there was no physician on duty at that place. But most emergency departments are going to have a physician, and then they'll have nurses, and they'll have techs, and they'll have nurse practitioners as well as physician assistants. Urgent cares will generally have one provider or maybe a couple of providers, a few providers that take care of the volume, and then they'll have maybe a few medical assistants, may or may not have RNs and LVNs associated with them as well, and then lab and x-ray techs available to do whatever testings they need. So you may, when you talk about primary care physician, it may not be a physician that's on duty at the urgent care to take care of that primary care need or the urgent care need, but know that whoever's there, that provider is trained to take care of that urgent care setting in that condition.
I'm glad you clarified that because when you said there was always a physician there, I know that you've been the go-to person in some emergency room settings. So I think know the value of nurses, especially advanced nurse practitioners like you are, where you've got the ability to prescribe. And I think that's important. I don't know if everybody knows that.
Yeah, I realize that whoever you see in the emergency department or the urgent care is trained to that level of care for sure. In the setting where I was the only provider in the emergency department, I'm trained beyond just the regular family nurse practitioner training. I've got emergency care training and certified in emergency care as well. So that the provider you see may or may not be trained to the level of everybody. So realize that doesn't mean they're not giving you good care. It's just the training levels are going to be different in any setting. And the person that you see may be trained as a family nurse practitioner or an emergency nurse practitioner, or the PA may be trained as a general PA or actually may have emergency training as well in the urgent care setting.
And your emergency care training includes delivering babies.
Unfortunately or fortunately, yeah, yes, that is the case. And I have delivered a few babies in the emergency setting. Yes.
That's wonderful.
Don't go to the emergency department if you feel like you're going, to the urgent care center if you feel like you're going to deliver your baby. The training is not generally there for the baby. However, in the urgent care settings that I've worked at, we do have some minor equipment to take care of emergent deliveries. And then we will certainly direct you to the location that you need to have your baby taken care of if you deliver in the urgent care setting, or at least try and get you to the emergency department before you deliver at that time too. So
Good to know. So what about walk-in clinics? I'm seeing these popping up as well in retail stores and pharmacies around the country. How are they different from urgent care centers?
yeah, most of the walk-in clinics may have one, maybe two people working in them. They're a great convenient care center. You can't get into your doctor, but you need to be seen for sore throat, minor injuries, and they're a great source of care. The one thing about the convenient care centers that are going to be in the walk-in clinics that you're seeing, like in the CVS or the Walmarts, those type of things, are going to be that they have a very limited scope of service. If you walk in with an abdominal pain, that's going to immediately be outside of their scope a lot of times. They have very limited scope of services available to them, and they provide great care. Again, when we talk about the quality of care, it's going to be the same, whether it be at the walk-in clinic or whether it be at the urgent care, or whether it be in the emergency department, based on the condition that you're presenting with. So if you have a sore throat, convenient care center is going to be great, urgent care is going to be great, and emergency department is going to be great, the same quality of care.
I found that the walk-in clinics are very beneficial if you travel for a living. I found that for myself when I had a really bad sore throat and I was out of town on business. I went to the walk-in clinic in a pharmacy, and the best part about that is when they were finished checking me out, they gave me prescriptions which were filled right there and then. And that made it really convenient.
Yeah, very convenient care. And I think when you think about walk-in clinics, kind of a misnomer, but I think convenient care clinic is even better name for those. And I think it's exactly that, Dana. A great place to get care when you need it, when it's available, and a great place to finish your care. In other words, getting the prescriptions you need filled right there as well. So.
Yes, that's very convenient. The other thing that they're very convenient for is vaccinations. And I know I've got several vaccinations in walk-in clinics, my COVID vaccinations, pneumonia vaccination, things like that. But they also have regular vaccinations for, they've got RSV, which people are now getting vaccinated for who are seniors. And it's a really great way to get that done. In fact, I was recently in a PCP office and asked for the new COVID booster and for RSV. And I was directed to go to a walk-in clinic because the PCP did not have the vaccinations.
Yeah, that's an interesting case that you described there, Dana. And don't forget about the urgent care for that setting as well. For the vaccines, some of the urgent cares are carrying vaccines available too. And realize that you don't have to have a walk-in clinic for the vaccination as either. A lot of the pharmacists have the capability to give vaccines at the pharmacy. So you don't even have to be at a walk-in clinic that's in a pharmacy. You can just go to the pharmacy for that as well.
That's true.
Another alternative for you.
That's where I went for my flu shot last year, was into a Walgreens, and it was very quick, and the pharmacist gave me the shot.
Yeah.
And they did a very good job too. That's the important thing, is people handling the needles, you want them to have a lot of experience.
Oh, there you go.
So we've learned a lot today about what is the difference between an emergency room setting and an urgent care and a walk-in clinic. The last thing I want to touch on, though, is 911. When does someone call 911 instead of driving themselves to an emergency room or an urgent clinic?
Yeah, Dana, I'll touch on that. I want to touch on one more thing that I don't think we've covered, and I apologize for not covering it ahead of time. But that's the emergency center that's not associated with the hospital. It's a freestanding ER, for instance. Some people feel like the urgent care and the freestanding ER are equivalent as well. realize that if it says emergency room or emergency department out there on the freestanding ER, it's going to have the same level of resource as well as people in the training to take care of that emergent situation, whereas the urgent care sitting next to it may not have that same level. So when you're going to find a place to be seen, look for those two differences. The urgent care is not going to have, still a freestanding department, but it's not going to have the same resources as the emergency department that's freestanding. And the freestanding emergency department is not going to have the hospital behind it to admit you to, but they'll usually have some arrangement with that hospital to be able to admit you to the hospital from there. So definitely keep that in mind.
That's really interesting because I passed one of those the other day where it was a freestanding, what I thought was an urgent clinic, but it did say emergency. And there was actually a drive-through area for the ambulance.
Yeah,
and there was an ambulance out front. And I thought that was interesting.
Yeah, some of the freestanding emergency departments will actually receive ambulance traffic as well as have that ambulance bay for taking patients away from the emergency department to the hospital or to another location as well. But back to your question about ambulances, since we're on that topic anyway, the 911. So, you have chest pain that you feel like is cardiac in nature. In other words, you feel like it might be your heart. Number one, don't go to the urgent care for that. Number two, you definitely need to go to the emergency department for that. So that's one criteria. So when do you call the ambulance versus driving yourself to the hospital or to the emergency department? It's really a tough question. If you're in a situation where you're by yourself, it's probably reasonable to call 911. If you're a block away from the emergency department, it might be reasonable to drive yourself or have somebody drive you to the emergency department versus calling 911, which might take you 3, 4, 5 minutes. But honestly, those 3, 4, 5 minutes may help you in the sense that you're getting care to your house to take care of you, and then somebody to transport you to the emergency department, and they can begin the care and the diagnosis of your heart attack in the ambulance. I was in the ambulance back in the late 80s, and things have definitely changed since then. They're doing a lot more in the ambulance and taking care of conditions a lot quicker and more advanced than it was back in the 80s when I was a paramedic. So calling 911 if you're about to deliver a baby, great option. If you've broken your arm, it's a great option. One thing to think about from 911 and urgent care, if you can't get to the emergency department, it's a great way for somebody else to lay eyes on you to say, hey, this is okay, and you don't have to go to the emergency department, or this is really bad and I think you need to go to the emergency department. So even if you're kind of on that fence, where do I go, what do I do, it may be reasonable to go to either utilize 911 or utilize the urgent care for that extra look, if you will, for somebody to help you make that decision.
I have a friend who recently had a heart attack, and she wasn't feeling well, she called 911. And she said the amazing thing to her was that the emergency room already had her EKG and all of those vitals they need to have to render a decision before she even got there, because it was all done in the ambulance as they were going to the emergency room. And she said it was just like in television that as soon as they pulled up and took her out of the back of the ambulance, she said there were already nurses and doctors waiting for her on the stretcher in the ambulance bay to take care of her.
Technology is a wonderful thing, and the communication ability that's between the ambulance and the emergency department is just wonderful. I was the director of an emergency department many years ago, early 2000s, and we actually were also in charge of the medical education and continuing education for the ambulance services and 16 different services in the communities around us. We had some of the ambulances that had the EKG setting set up to ping it directly to us in the emergency department. We had some people that went straight from their house to the cath lab in our hospital and bypassed the emergency department. So don't expect that on every emergency ambulance ride and into the emergency department, but But even back then, 20 years ago, we were able to do that in some situations, and it really saves time, and it saves heart muscle, which is a great thing. So definitely call 911 when you feel like you need it, and it can decrease the amount of time that's between you and the care that you need. So
She did go immediately into the cath lab,
yeah,
and they put in a stent, and that was on a Friday, and she was out walking around here where I live by Monday,
yeah,
and she
pretty
looked
incredible.
great.
Yeah,
It was
pretty incredible
amazing.
stuff, isn't it? The advances in care and delivery and technology is just amazing in the 40 years I've been in healthcare. So
Well, I really want to thank you for being here with us today, Ken. This has been really informative, and I appreciate all the information that you've given us and your time. And I want to thank you for watching. We look forward to seeing you at another one of the Barcliff Group Fireside Chats. Thank you.
thanks, Dana.